Hello there, and welcome to Journey to Recovery. Our podcast focuses on the co-occurring disorders of mental health and substance abuse. We present a wide range of thought-provoking, hopeful, and positive topics from a clinical yet practical perspective. Our host is Dr. Hal Baumchen, a licensed clinical psychologist and licensed alcohol and drug counselor. He's the executive director of Northland Counseling Services and the clinical director of North Star Regional Co-occurring Disorder Treatment Programs. He's an author, speaker, and clinician with over 30 years of counseling experience. I'm here today with Tim Bode, Operations Director for Northland Counseling Services, and Dr. Hal Baumchen, Journey to Recovery host and resident expert. Hey guys.
Hello, Gaylen.
Morning, Gaylen. Thank you for that.
So our topic today is treatment for co-occurring disorders. Last podcast we talked about definition of what co-occurring disorders is, and we talked quite a bit about a client of yours who you called Jackson and his experience, your experience with him.
Right, and if you recall, he had been drinking a lot, 10 to 12 bottles of beer a day, or cans of beer, and then I think that went up to 12 to 18 at one point, right before he went into treatment. And he thought he had maybe a heart problem, so he went to the hospital.
Mm-hmm. And so he was dealing with anxiety, as well as his substance use problem.
Yep, panic disorder, anxiety problems with heart palpitations, shortness of breath, sweaty all over. And then he was constantly worried, had ruminating thoughts going over in his mind. So yeah, he had some anxiety, lots of anxiety. And that got so bad at one point that he went to a doctor, got an anti-anxiety medication like Xanax or Ativan. And then he got addicted to that as well. So he had prescription med addiction, alcohol or substance use addiction. And he also had that anxiety disorder, making him a co-occurring disorder case. And that so he was looking for a co-occurring disorder treatment program to help him with that. Mm-hmm. So that's how he found us. Mm-hmm. We should define co-occurring disorders again. I asked the guys in the treatment program what co-occurring disorders were. And these are guys that are in a co-occurring disorder treatment program. Yeah. One of the guys says, well, that's when you do the same thing over and over again.
He was probably thinking of reoccurring disorders.
Right. And the problem with co-occurring disorders is it's often reoccurring as well. So he wasn't far off. I think that can really happen, and I'll bet it happens for most of the guys in our program where they have the co-occurring disorders of depression and substance abuse, and then they get better, have some time of recovery, and then relapse. So you could relapse in both of those. You could relapse with the substance abuse and relapse with the mental health problem.
Yeah. So what kind of treatment is helpful for someone with a co-occurring disorder of substance abuse and mental health?
Co-occurring disorder treatment has to address the unique symptoms experienced by the client, and treatment has to address both the substance use and the underlying mental health problem. Of course, in this case, we're talking about the alcohol abuse and the prescription medication abuse and also the anxiety. So we got to find a treatment program that's going to manage all of those components. Treatment is designed to achieve abstinence from the substance abuse problem and to reduce symptoms of the mental health disorder.
So treatment needs to help the client get sober and then stay sober.
Right. I frequently tell clients that treatment is designed to reduce symptoms and prevent relapse, so both of those components are necessary.
Mm-hmm. And you usually expect abstinence from all substances?
Right. Some programs are moving toward harm reduction, but the programs that I work with, we expect abstinence from all substances. So no alcohol, no marijuana, no other street drugs of any type.
What about psychiatric medications?
In this particular case that we're talking about, psychiatric medications would be helpful for somebody with an anxiety disorder. They don't use we wouldn't use anti-anxiety medications because they're addictive, but we would use something like an antidepressant medication to try to help him. And so that's a nice exception, Tim. So no street drugs, but use prescribed medications from the doctor as they're prescribed. So get medical compliance. And those are helpful in order to regulate emotion, manage depression, and we try to teach some coping skills in the program as well. So there's psychological intervention and psychiatric intervention that are going to help, along with reducing the substance use.
Right. So with a complicated case like Jackson's that we've been talking about, how do you know where to start in order to get him some symptom relief and some long-term help?
So I think some of these assessment tools are necessary, and the doctors, like a clinical psychologist would examine and the psychiatrist would examine, and the substance use counselors would do an assessment. And so there's some good information that's generated. We come together in a team. We put together a treatment program for somebody like this so that we're actually hitting the right components and really get them some help right away as fast as we can, so that he's anxious, and he's also withdrawing from the alcohol or drugs somewhat. And so we try to get him some good comfort, but also get some good treatment for him as well.
So what are some of the components of an assessment that you look at?
Well, again, relational problems, occupational problems. Does he need housing? Does he have any kind of cognitive disorder or mental health problem in addition to the obvious one, which was anxiety? Does he have any attention deficit disorder, any depression? So we're looking at all of those aspects.
Yes, it sounds like a very extensive and thorough process.
Right. We want to get a good, thorough history. What was it like for you in your childhood and adolescent years? And also, when did you start using? What other drugs did you use? Any trauma in your life? Any TBIs? So good, thorough history is really helpful here. The more issues directly addressed by the treatment team, the more likely a positive outcome can be achieved. So if he had all these things that I just talked about, but we only addressed one or two, maybe he'd end up relapsing.
Do all treatment programs come at it in the same way?
What do you guys think?
Probably not.
Probably
Right.
not.
Yeah, that's exactly right. They get close, some of them, and we're talking about co-occurring disorders here. Not everybody treats it that way. But a case like this, I think it's appropriate to try to hit all of these different things he's got going on in the same program.
I would guess that some programs, rather than treat it all together at the same time, approach it in a more sequential manner.
Right. So not very integrated. We're going to talk about an integrated program, but that sequential program would be to treat, say, the alcohol use for Jackson. Like, stop drinking and we'll help you with that. Then, but I'm really anxious. I'm worried all the time. Well, after you quit drinking, then we'll release you from our program and you can get help for that. If you still have any anxiety, you could get help for that later. That would be sequential. So we do one at a time.
Right. And that really doesn't sound like the co-occurring disorder treatment that we've been talking about here on the podcast.
That's right. So it's not fully integrated. Let me give you another one, this parallel treatment where you kind of do them both. And sometimes programs do them like down the hall. So you can get mental health down the hall and you can get substance abuse treatment here. And you can get them sort of at the same time, but they're not very integrated. They're more parallel, happening kind of together, but not integrated.
And not necessarily by the same provider.
Right. And we might not know what Dr. Jones is doing down the way, or not, at least not very well. And sometimes those are off-site treatment providers, or you start toward the end of your program. So it's not integrated.
Right, like you said, not integrated like we've been talking about.
Effective treatment needs to help the patient identify signs and symptoms of co-occurring disorder, and that means helping the patient understand how the mental health problems, like the anxiety in this case, how the mental health problems interact or affect the substance abuse, and how substance abuse interacts or affects the mental health problem. In my world, that piece is absolutely essential. Treatment needs to address psychiatric, medical, emotional, and psychological problems.
It has to help the patient with social and relational difficulties, legal problems, housing, jobs, finances.
Right, and if you don't help the patient with all of those, have you really helped them? That's the point here. That's true in this case that we've been talking about. But yeah, if we're going to do a co-occurring disorder program, we need to hit those social, relational, psychological, psychiatric things, hit it at all angles. I say hit it with a shotgun. I don't really mean that, except hit it from lots of different angles. Mm-hmm. Effective co-occurring disorder treatment programs identify the warning signs of worsening substance abuse and worsening mental health problems. Try to teach that to the client so they can see that things are getting worse for them, get the appropriate treatment.
And that treatment includes both medication when appropriate and counseling.
Right. We've talked about this before, that if you have medication and counseling, statistically, or the research seems to indicate that both of those together work better than either one alone.
Mm-hmm.
When you have both mental health problems and substance abuse issues, it certainly does get complex, doesn't it?
Right. I was going to bring in a Rubik's Cube, and I didn't. Co-occurring and substance use and mental health problems are complicated, and it might be best described with using that Rubik's Cube analogy. That's a fascinating little puzzle that appears really simple, but it's baffling in its complexity. If you rotate one column on one axis, then the steps needed to put it back into the completed puzzle just are very simple.
Mm-hmm. But if you move 2 or 3 columns separately, you definitely increase the possible variations dramatically.
Bingo, Gaylen. Yahtzee, bullseye. When you move columns and rows on 3 different axes, you end up with 43 quintillion different possible configurations in a Rubik's Cube.
Okay, millions, billions, trillions, quadrillions, followed by quintillions.
Yeah.
Wow.
That's a bunch.
Yeah, and not one, 43 of those, yeah. 43 quintillions. The exact same number the twins were behind in the pennant race a few years back. Yeah, it's a big number. In the same way, substance abuse and mental health disorders each make the other one more challenging and severe. I like thinking of the psychological problems and the psychiatric problems and the chemical dependency problems, and you have those 3 axes rotating at the same time. And so it is much more, it's not really more severe, it's more complex. Mm-hmm. And so at Journey to Recovery, and the treatment programs that I'm involved with and the materials I write, we're looking not to make things more complicated because it's complex, mm-hmm. but actually make things more simple because it's so complex.
Mm-hmm. But just like with a Rubik's Cube, there is a solution.
Right. And great news here. It doesn't take 43 quintillion rotations to solve this thing.
But it does take a strategy, or I guess we could say a game plan.
Yeah, absolutely. And I've seen people put this thing together from a scrambled position in less than 10 seconds. It's unbelievable. And they've got a strategy and experience. It's a game plan, and they've well practiced. They've even got a special cube that rotates a little easier than the one I have, of mm-hmm. course. But you got to have a game plan. You got to have a strategy. And that's what co-occurring disorder treatment does. We've got a strategy to help the complexities of a co-occurring disorder.
Right. And the strategy includes that integrated model that we've been talking about.
Yep. It's got to include psychiatric evaluation and medication for someone who's, let's just say, is bipolar or has a manic episode. So we get them stabilized on a medication. And then the psychological part of the treatment focuses on changing the way you think, or finding coping strategies, or understanding and identifying cues and relapse triggers, all of those kinds of things. Managing stress might be in there, or fixing up your relationships, rebuilding trust. All of those psychological, psychiatric, medical things have to be managed at the same time.
And all that in the context of how that impacts the substance abuse.
Right. So don't lose focus there. I thought I was here to fix my alcohol use. You are, but you're going to keep drinking if we don't help you with those other areas of your life as well.
So integrated treatment leads to higher recovery success rates.
Absolutely
And,
right.
And the most effective integrated programs accomplish several different things, as we've kind of talked about. So we have a list of 10 things that we want to pass on to our listeners today. The first of those is to help the client identify signs and symptoms of co-occurring disorders.
We want to do some evaluations to help the client see the signs, like what would you look for if your anxiety was getting worse? And oftentimes they know that from their own history.
Mm-hmm.
Number 2 is providing screening and assessment for mental health and substance use disorders.
That's more for us as a treatment team. We're going to want to see the level of depression or the level of anxiety. We want to look at the history of bipolar illness or past manic episodes or something like that. We want to look at other drug and alcohol problems as well.
The third thing that a successful integrated program will accomplish is to identify the interaction of substance use disorders and mental health problems.
Do you drink more or use methamphetamine more, under certain situations or certain circumstances or certain mental health symptoms that you're self-medicating?
Number 4 is to offer direct access to psychiatric providers.
Psychiatrists are tough to get an appointment with. So if you don't have direct access in your treatment program, you're going to refer down the street. It can be a month. Well, the guy's treatment program is over, or her treatment program is ending by the time she gets an appointment with a psychiatrist. Mm-hmm. So a good co-occurring disorder treatment program has access to a provider.
Number 5 would be present integrated and evidence-based treatment for co-occurring disorders.
So things that come up here, motivational interviewing, which is a nice way to introduce a client who's maybe a little reluctant to getting treatment. So it helps them without pushing or forcing or commanding and demanding that the client get treatment. So motivational interviewing is one of those, and cognitive behavioral therapy, and there are others as well.
Mm-hmm.
Number 6, teach symptom reduction and relapse prevention planning.
Right. So those two things always going together. Effective treatment does two things. It reduces symptoms and prevents relapse. So we want to find specific challenges, specific ways to do both of those. Teach them to the client so that they can do that. What do you look for if you started slipping again? I've written a chapter called The Road to Relapse Prevention, which looks at a number of different things that you should be watchful of to make sure you're not slipping backward. Like so many things in life, if you're not moving forward, you're probably not stationary, you're probably actually slipping backward.
Mm-hmm. The 7th thing that a effective integrated program accomplishes is to assist the client in finding available community services.
Including housing, probably a big one, but also good medical treatment for ongoing medical illnesses or concerns that they may have, dental care. Methamphetamine is tough on the teeth, and so they might need help in a number of areas. Finding a job, staying employed, finding social skills, training, relational problems, and getting good care for that. Getting a job can be tough because some of these guys are coming, or men and women are coming with felony records for drug charges, and it's a little harder to get employment, but it's very important to have that structure, feel good about yourself. So we want to help somebody find those community services that are available.
Number 8 is to address past trauma issues.
Good co-occurring treatment centers are trauma focused, or they're aware of traumatic issues in a person. So that can change how you drink, how you use, how you see yourself, how you work, all kinds of things. So we want to identify trauma issues and address them.
And what are some examples of those trauma issues?
There are a million of them. You didn't really catch me off guard. It's just hard to sum up.
Yeah.
But all the abusive stuff that you might have endured, but car accidents, watching somebody get killed in front of you in a gang, watching somebody overdose, that comes up way too often, Tim. It's just so sad, and it's sad to hear them talk about that. He died in my arms. She died in my arms. You shouldn't have to hear that story, but that person shouldn't have to live through that, but they have. So we want to address those traumatic issues when we can.
Yeah.
Number 9 is aid clients in developing pro-social attitudes.
Right. So let's be careful about the crime, and we don't want you to go back to jail or prison. So those are those pro-social attitudes instead of the asocial or antisocial attitudes. So we want to teach them how to live within the confines of the law.
Number 10 is to support clients in discharge planning, including employment and housing.
So right from the beginning, can we start talking about what will life be like for you when you leave here? Where will you go? Oh, I'm interested in your 4-month intensive outpatient program. Great. Where will you go after that? I'm interested in your housing after that. So it's nice. Then what are you going to do? Well, during that time, I'm going to find a part-time job. Great. We'll help you with that. So let's start discharge planning right away in the beginning. All of these things that we've been talking about are all combined in that integrated treatment for co-occurring disorders. If you do all of those, you have a great chance of having a long-term successful recovery and getting the life you've always wanted.
So today we've been talking about treatment in co-occurring disorder programs, and these integrated programs provide evidence-based treatment for co-occurring disorders, and they use these treatments to help reduce symptoms and develop relapse prevention programming.
Thanks for listening to today's podcast on the treatment of co-occurring disorders. You can download materials that help you develop skills to identify emotional problems, reduce symptoms, and prevent relapse at journeytorecovery.com. We've been visiting with Dr. Hal Baumchen, a licensed clinical psychologist and licensed alcohol and drug counselor. His expertise and clinical wisdom is now available at journeytorecovery.com. Share this resource with your peers and colleagues. See you next time. Remember, recovery is a journey. Enjoy the ride.